Typhoid, the hidden enemy. Typhoid is a bacterial infection caused by the bacteria Salmonella typhi, and it has been silent killer for the many centuries. It is responsible for the deaths of the millions. Do you know the fact that typhoid causes the 21 million cases and 2 lakh deaths annually? The typhoid fever spreads through the contaminated water, contaminated foods, and there is a one typhomary which cause and without any symptoms. The typhoid, that is the its vaccination is the crucial really, and it helps to uh, against the symptoms of the typhoid fever. They're up to 104 Fahrenheit, and diarrhea, chills, headache, stomach pain, abdominal pain, and the in severe cases there is an enlargement of the spleen and liver also. They since the patient symptoms, and there are the red rose rashes, the small the red spots found on the chest and the belly, that is the symptoms of the typhoid. And uh, the antibiotics affects on to typhoid, it is the bacterial infection of course, so antibiotic affects on is the commonly the cephaloxacin, that is antibiotic commonly used, and the prevention is the vaccination of the typhoid, and the diagnosis of the typhoid can detect through the stool, through the urine, because it is the disease of the digestive system related disorder found in mainly the intestine. So the through the stool, through the urine, we can detect the typhoid, and okay, that is. So this was about the introduction, brief introduction about the typhoid. Now I am going to tell the funny part about the typhoid. What happened once in 90s in New York City, there was a woman, uh, the Mary. Okay, so the Mary was the famous cook there, and people were thinking, so what is the magical thing? What magical ingredients that the Mary adds in her cooking? But the ingredient, you know what? The typhoid fever that spreads through the unknowingly, not the mistakes, not the knowingly, not the bad intention. She doesn't know the symptoms because she never have the symptoms like the fever, headache, and the stomach pain. She never had, but she spreads through the that. So how the so what happens actually, then she cooked, and she gives her recipe to the everyone, and she was the famous cook, but the people started falling ill, and they think, why do we falling ill, and how do the people falling ill in our areas, what was the reason? So they find that the famous cook in the New York City, that is the Mary. So so the Mary don't have a bad intention, but okay, but it is very important to wash our hands, and that is I don't want to share the knowledge about that is the part, but what actually the typhoid Mary, this name actually brings from this story actually. Yes, New York City. So then what, she was famous cook, then she changed her name and work as a cook again. Actually, if you change any name, but the typhoid spreading also that way. So after changing a name, she cooked, and but there was the spreading the typhoid again. But the people and the doctors, researchers caught her again, and uh, told her that, Mary, we love your cooking. We love. Definitely, it is very tasty. But it is not good that you are spreading the typhoid. So please, what is the moral of the story? Wash your hands before the cooking and staying the hygiene. Mary don't have a bad intention actually. She what does, she is a infamous, very infamous cook. And what I would like to tell here that the Typhoid Mary, how his name came from this story. It is the story very interesting and very famous. So I am telling you this. Thank you. Antimicrobial resistance. So what is an AMR? So there are the antibiotics that are resistant to the bacterial infection caused in the urinary tract, caused in the intestine, typhoid, and pneumonia. What are the maybe the research are the research about is that the antibiotics are resistant to the bacterial infections. The various antibiotics and effects on the various microorganisms and matlab that is the bacteria present in the body. Uh, there are the gram negative bacteria that cause the harm to the body, that are the foreign that cause the harm spread in the urinary tract infection, typhoid, pneumonia. I told you as. So what the gram negative bacteria, it is the isolated, as there are the 30% isolated, 12% isolated, the various uh, they are species. So what their resistance to the bacteria, the antibiotics. So there are the research about the antibiotics, that the various antibiotics affects on the various microorganisms, various bacteria. Of course the typhoid is a bacterial infection, so the antibiotics works in that case, and that is the resistance. Okay, so there is a AMR research that tells us that they are the antibiotics that resistance. And okay, now I am going to tell you that how does the typhoid affects the body. Does typhoid affect the bloodstream? Does typhoid affects the direct organ? No, that is not the case. Typhoid doesn't affect the direct into the bloodstream. What happened? Actually, it is the bacterial infection in the mainly intestine. If it's found in a intestine, then there is a inflammation to the intestine. There is a irritation to the means there is a pain to the stomach. If it is found through the gut, in the gut health, in the gut, there are the microorganisms several. So it affects the microorganisms. It reduces the typhoid fever, the good microorganisms, and the there are found a pus through the it, and it is not like to the healthy body. Okay, so there is a gut health affects affected by the typhoid. And another is the spleen. There is a enlargement of the spleen in the several cases, that is the splenomegaly. And the liver also affects, there is the inflammation of the organs on the typhoid. So there are the cases that are found the typhoid, it doesn't affect the into the bloodstream directly. It affects but doesn't affect it directly, but it affects the this is the intestine. And 25-year-old patients come traveled from the other countries to and came to you, and he says I have the abdominal pain. So how do you treat that the patient? You are becoming a doctor, so how do you like to treat that patient? See, we have to first take the history of the patient, that uh, did you take any contaminated food or water? Did you have any unhygienic places and any unhygienic uh, activity? Because that can affect directly. It is the oral infections, the abdomen are like to spread through the oral and the food tracts and through the hair. So it affects the bacteria gut health of the body, so it is not good. So we have to ask the medical history about the contaminated food, or have water in spicy, unhygienic, unhealthy food. And there is a various taste in the moderns. Um, there is complete blood count, CBC test, and you we can test the urine, and there is a stool test. So various tests are for the abdominal pain, and we can confirm the diagnosis about it is the malaria, it is typhoid, is it pneumonia. So it is a way to treat the person, and we can give the antibiotics also affects, definitely affects on it. But okay, this is, and according to Ayurveda there is a typhoid called the jwara, Visuchika. What is the Visuchika and what is the Jora? Jora is a fever. There are the types of the Jora. So under there is a typhoid. Various Jora. Jora is not a one type. Jora is lots of the differentiate types, and one of the it is the typhoid. And the Visuchika is about the uh, digestive system related disorder which have the abdominal pain, and okay. So it is in the typhoid there is a pitta dosha. We have to reduce the pitta dosha of the person because this is the jwara. So pitta affects on its pitta prakupit. So we have to reduce the pitta dosha. And there are the uh, treatment that the antibiotics according to modern and according to Ayurveda there is a Haridra, Amlaki. It's are the highly antibiotics, and that affects the typhoid and in a good manner. And we have to, there is a panchakarma that is influences the body. There is a langhana is the, that is langhana, it is what it is called, upvas. Langhana is the upvas, that is in that case your that disease, you may feel the relief to the typhoid, or you may take the not heavy diet. Heavy diet affects the bacterial infection badly. Yes, you hear right. You have to take the light diet. Okay, so that is a, so there is a research. One of the research says that the climate change affects the typhoid fever, the transmission of the disease, that impacts it. How there is a temperature rise and the fall, it affects. There is a water falling, snow, and there is a cloudy, and it affects the typhoid. Okay, if there is a flood, rise in the sea levels, that also affects the typhoid, because the climate change that affects our body, the foods that we are surrounded and taken daily, that affects our body. So climate change affects the diseases. So we have to maintain the hygiene, and we have to take the healthy food. So this is all about the typhoid, and thank you for listening me. This is my first video that I tried. I am not perfect. That is the doctor that I tell the all information. I collect the information from the research. I tried my from my side. Uh, I maybe sometimes the wrong my words are the, this is my first video, but I will try, I will maintain myself, and we will see. Please comment, okay, and tell me how was the video, and see you again later.